I'm Trudy Hinson. I'm the Public Health Program Director for the Center for Health and Homeland Security at the University of Maryland, Baltimore. A quarantine is a non-pharmaceutical measure that's used to help prevent the spread of disease. So often with quarantine and isolation, people are asked to stay home or they are put in particular places so that if they might have been exposed to the disease or have been exposed to the disease, they won't spread that further. In the United States, quarantine is frequently a voluntary measure. You'll see public health officials asking citizens or residents to stay home if they're not feeling well, if they think they might have been exposed to a particular disease, in this case, the novel coronavirus. But state, local, and federal officials have the ability to order quarantine, in which case that is a legally binding order with law enforcement powers behind it, and people can be asked to stay home or they can be asked to report to places of medical treatment. Quarantine and isolation are different. They're frequently used together. Isolation is actually technically when you are already ill with the disease. Quarantine is a measure if you might have been exposed or you're at high risk of having been exposed but are not yet ill. In small outbreaks, quarantine and isolation can be particularly effective in preventing the spread of the disease, especially if it's a new or novel disease such as this coronavirus, which we don't know a lot about. We're still building the disease profile. One of the cons of quarantine can be that it is fairly intrusive on civil liberties, which is something we value very much in the United States. And people, if they're worried they're going to be quarantined, might do things that can actually spread the transmission more. So you might see people avoiding going to healthcare facilities if they're worried that they might get asked to stay home. You might see people traveling without necessarily indicating that they should be traveling, or they might not be well, and you'll see that it can actually spread the disease. Mandated quarantines can be very effective, again, in small outbreaks. In the United States, they're going to be very difficult to enforce. They take a lot of manpower to enforce, and particularly in the United States, we found that voluntary quarantines work better. People prefer to have the option to say we're going to do this and follow through. There's no specific trigger. It's kind of an accumulation of events. So particularly with a newer novel disease like this coronavirus, you might see people issuing quarantine orders more quickly than you would with something like, for instance, we don't issue quarantine orders with the seasonal flu. But there's no specific trigger. It's just health officials seeing a public health threat and taking action to prevent the spread of the disease. Quarantine orders carry the effect of law, and they can be enforced by law officials. So in some cases, for instance, in 2014, when we had a couple of cases of Ebola in the United States, you saw police officers standing outside of particular apartments where people were quarantined. In a large-scale outbreak, those kind of quarantine orders with that kind of law enforcement is just not going to be feasible. At the federal level, we've seen the United States institute a travel ban. So they were monitoring people that were returning from certain parts of China. They were only allowing U.S. citizens that were returning from China to come into the country, and they also issued a federal quarantine order for those citizens when they returned. We're also seeing a lot of discussion now about the testing for the coronavirus. So the FDA and the CDC are working to get testing kits out to the state and locals so that we can have a better picture of what those outbreaks look like, to make sure that we're capturing accurately the number of coronavirus cases. The biggest thing is that preparation isn't panicking, and that's not something we're used to in the United States. So when we hear officials say, you need to be prepared for significant disruption, you need to think about having 2 weeks supply of food, a lot of people think that's a signal that something terrible is going to happen. And a lot of times that's not the case, it's just preparation. So I would say preparation, not panic.